Singapore is facing a rapidly aging population. By 2030, 1 in 5 will be 65 and above. This means a growing number of people with chronic diseases. The hospital-centric model is no longer sustainable to provide episodic treatment, and we need a new healthcare approach. Additionally, a group of this aging population suffers from multiple health conditions and is unable to take care of themselves properly. Meet Auntie Jane. She's 70 and suffers from high blood pressure, high cholesterol, and diabetes. She lives by herself and often feels lonely. Her medical conditions, coupled with her lack of determination to manage her health properly, often see her getting in and out of the hospital several times within months. Usually, after her discharge from hospital, even after the right follow-up medications and treatment, Auntie Jane still finds it difficult to take care of herself. The many different types of medication dispensed from both the primary care and specialist outpatient clinic always seem overwhelming and confusing. Most of the time, Auntie Jane will neglect her medicines. That includes administering herself with insulin injections to control her blood sugar. Her multiple health conditions also do not allow her to move around freely. This makes it difficult and confusing for Auntie Jane to navigate her way through the health system. A lack of coordination between her acute care, primary care, and specialist outpatient clinic often means she doesn't get the timely support she needs. Many times she ignores her appointments, and within months, due to a lack of proper care, Auntie Jane's health deteriorates to a crisis level again, where she would call for an ambulance to admit her to the hospital. Auntie Jane is identified as a frequent admitter as she gets warded for the 3rd time within a year. But what if there was a dedicated care team that was given overall responsibility of coordinating Auntie Jane's care plan? Introducing the Integrated Regional Health System Care Team, or RHS Care Team, that takes care of frequent admitters such as Auntie Jane. It comprises a multidisciplinary team of case managers, doctors, nurses, pharmacists, therapists, social workers, and volunteers. The members of the team discuss Auntie Jane's conditions and develop one care plan to help her manage her high blood pressure, high cholesterol, and diabetes. The care plan coordinates her follow-up visits to the primary care doctors and specialist outpatient clinic. The care plan also engages the help of a community volunteer group to escort her to her appointments. Auntie Jane's medications are reconciled as well so that she doesn't get overdosed or feel overwhelmed by them. An occupational therapist from the care team visits her to offer suggestions for a hazards-free home. Meanwhile, the case manager also coordinates with other social groups, such as Meals on Wheels, to cater a diet plan that's suitable for Auntie Jane. Another social group visits her regularly to keep her company. On the occasions when Auntie Jane does have a crisis, she calls her case manager rather than an ambulance. Auntie Jane's social and healthcare needs are better met and managed holistically, and she feels happier and healthier at home. So let's recap what transformed Auntie Jane's care. An integrated RHS care team is a multidisciplinary team of doctors, nurses, therapists, pharmacists, volunteers, and social workers from acute care, primary care, and community care sectors. The RHS care team develops a holistic one care plan for Auntie Jane, and with it, organizes her medications and follow-up medical appointments so that they are easier to manage. A case manager from the team is always there, 24/7, 365 days, for Auntie Jane, Uncle Lee, Mr. Muti, and Madam City to contact whenever they need help. We can strive to transform the care we provide to an ideal state, where the management of population health is innovative, longitudinal, lasting, integrated, person-centered, and seamless. The RHS Care Team, integrating care. One care plan.